Hi, I'm Dr. Gwantwa. Welcome to a talk about a subject that is important in every young adult's life: sex. Some people may feel uncomfortable talking about sex, but understanding sex is important in protecting our health and is part of growing up. Sex is a word that may be used to differentiate between a male and a female. For example, I am of the female sex. But today, we are talking about sexual relations or sexual intercourse, often called sex for short. When two people feel strongly attracted to each other, they may have a desire to become closer. This can lead them to develop a sexual relationship. Sex is needed for reproduction throughout the animal kingdom, including our own human species. Sex is a private matter, but it is not shameful, since it is a natural, normal part of all life. Sex can also be enjoyable, but it can spread life-threatening sexually transmitted diseases such as HIV/AIDS, HPV, and syphilis. Whether or not to have sex should be your choice and your choice alone. You need to be knowledgeable about sex so you will know the risks of sex and the role of sex in your life. So let's talk about some common questions asked about sex.
I'm a little unclear about the sexual organs. Can you explain them?
First, we should talk about the external and internal organs involved in reproduction. The external organs of reproduction are often called the genitalia. In a man, the genitalia consists of the penis and the scrotum. The scrotum is the sac of skin containing the two testicles. The testicles are where sperm are made, which contain the genetic information needed from a man to make a baby. The genitalia of the woman are the labia, which are small loose flaps of skin at the opening of the vagina. The opening for urine or pee is at the front of the labia. Inside the abdomen of a woman are the two ovaries, which have thousands of eggs. The uterus is the muscular organ where the egg attaches when it is fertilized by the sperm and develops into a baby. The two fallopian tubes connect the ovaries to the uterus. When an egg is released from the ovaries, it passes through the fallopian tube into the uterus. The vagina is a stretchy tube that passes from the uterus to the outside of the body. The baby goes through the vagina when it is born. The vagina is also where the man puts his penis during sex. This is called vaginal sexual intercourse because the penis is put in the vagina.
I have heard the word, but what exactly is sex?
Generally, when we talk about sex, we mean that the man's penis is inserted into the woman's vagina. During this process, the man may release a liquid called semen. The release is called an ejaculation. The semen contains sperm which have genetic information of the man. If the semen with sperm pass into the woman's vagina, the sperm can move to the uterus and even the fallopian tubes. If an egg is in these areas, the sperm can combine with it and this becomes a fertilized egg, meaning it may grow into a baby. The fertilized egg attaches to the lining of the uterus and it grows for 9 months inside the uterus. At the time of delivery, the baby passes out of the uterus through the vagina and out of the body. There are also other types of sexual intercourse beside vaginal sex, meaning the penis is in the vagina. Another form of sex is called oral sex, where the mouth is used to stimulate the male or female genitals. One cannot become pregnant with oral sex, but sexually transmitted diseases can be spread this way. Another type of sex is called anal sex, where the penis is inserted in the anus. Pregnancy is uncommon with anal sex unless semen leaks into the vagina, but sexually transmitted diseases are spread with anal sex.
You mentioned the risks of sex. What did you mean by that?
One serious risk of sex is sexually transmitted disease. We often refer to sexually transmitted disease as STDs for short. STDs are infectious diseases that are spread from one person to another through sex. This can be vaginal, oral, or anal sex. Some infections spread through body fluids such as semen, vaginal fluids, or blood. STDs can also be spread by any type of skin-to-skin contact in the genital area. Anyone having sex can get STDs. Part of the reason is that you cannot tell if someone has an STD and they may not even know they have one themselves. Here are 3 things that can increase the risk of a person becoming infected with STDs. People who have sex earlier in life increases their chance of becoming infected. Another reason a person is more likely to get an STD is when someone has many sex partners. With many more sex partners, there are more chances for the spread of disease. A big risk for becoming infected with an STD is during unprotected sex. Unprotected sex is when a person does not use a male or female condom during sex. A condom is a thin sheath that fits over the penis or inside the vagina. It serves as a barrier that prevents pregnancy by stopping the sperm from reaching the egg. It also reduces the risk of sexually transmitted diseases by preventing the contact of bodily fluids that can spread the infection. If you think you may have had exposure to STDs, get tested. The good news is that STDs can usually be cured or treated. Another risk of sex is an unwanted pregnancy. Having an unexpected pregnancy and baby can change the course of life for all the people involved. Pregnancy is also a health challenge for women, especially young women. So going through a pregnancy is a serious health risk.
How can I be absolutely sure I won't get pregnant?
The only way to completely avoid the risk of pregnancy is to not have sex. This is called abstinence. Anytime semen or the penis gets in or even near the opening of the vagina, there is a chance of a pregnancy, even if there is not an ejaculation. Pregnancy can occur because sperm can leak out of the penis anytime it is in or near the vagina.
What are the most common types of birth control methods?
If a person is having sex, pregnancy can be avoided by using birth control methods. There are many different choices for birth control, and some are more effective than others. Condoms, for example, can be very effective for birth control if used properly. A condom is a thin sheath that fits over the penis or inside the vagina and creates a barrier that prevents the sperm from reaching the egg. This barrier also reduces the chance of becoming infected with an STD. The reason condoms may be less effective is that they are sometimes not used properly or not at all, and pregnancy or disease can result.
Let's talk about how to use a male condom. Before opening the condom package, squeeze the condom away from the area where you will be tearing by pinching it with your fingers. This avoids damaging the condom when opening the package. After removing the condom from the package, hold the tip of the condom between the finger and the thumb. This will remove air from the tip where semen will later be trapped. Next, put the condom over the tip of the erect penis. While squeezing the tip of the condom, use the other hand to roll it down over the length of the penis. If the condom doesn't unroll, it is probably inside out, so try again with a new condom. A new condom should be used because there may be sperm on the old condom. After ejaculation, hold the condom while withdrawing the penis from the vagina to avoid any leakage of semen. Wrap the condom in tissue and put it in the trash.
Other birth control methods that are much more effective than condoms include the pill, Depo-Provera injections, implants, IUDs, and sterilization. The pill is taken once a day and delivers hormones to the woman's body to prevent pregnancy. A woman can become pregnant almost immediately if she stops taking the pill. Depo-Provera injections are effective for months, and implants and IUDs work for years after they are placed by healthcare providers. Implants are put under the skin of the upper arm, and IUDs are placed in the uterus with minor procedures in the office. These can all be removed if the woman wants to become pregnant. Sterilization is a permanent birth control method that can be done for a man or woman without affecting the sexual desire or altering sexual performance. However, these other birth control methods do not prevent the spread of STDs. Only condoms prevent the spread of the infection because they keep the semen and other sexual fluids from coming into contact with the other person. So using a condom and another more effective birth control methods provides the best protection against both STDs and pregnancy. All these birth control methods are available through health centers. Anyone of any age can obtain contraceptive advice from the healthcare system. You will be informed about your choices and make a selection with the help of the healthcare provider. Condoms are available in many locations in communities.
What about masturbation?
Masturbation is when the hand is used to stimulate the genitals. You may hear various myths about masturbation, but the medical fact is that masturbation is safe. You cannot get pregnant or get sexually transmitted disease from masturbation. As long as it is done in privacy and doesn't interfere with your life, it is not a problem. Men or women should not feel guilty about masturbation.
What is an orgasm?
The release of tension that happens during sex or masturbation is called an orgasm. The heart beats faster, muscles in the genitals spasm, and it can feel good in your genitals or across the body. Orgasms vary widely from person to person, and these differences are normal. When a male has an orgasm, the penis squirts a small amount of semen containing the sperm that can cause a pregnancy. This is called an ejaculation. However, some semen leaks out of the penis even when not having an orgasm. This is why it is possible for a pregnancy to occur during sex without the man having an orgasm or ejaculation.
How will I know when I'm ready to have sex?
Deciding to have sex is a big decision to make. Sex can be pleasurable, but it has risks such as STDs. You cannot tell who is infected, and if you become infected yourself, there can be major consequences to your health and life as a result. Testing can help identify some of the serious diseases, so getting tested before sex is very important. You also need to think about the risk of pregnancy with sex. You need to be prepared financially and emotionally and have a good relationship with your partner if you're considering a baby. Planning for the child and its welfare will give it the best opportunity for the start of its life. Otherwise, abstain, use birth control, and choose either female or male condoms to protect against pregnancy and STDs. Remember that only condoms protect against STDs, and you can either use male or female condoms during sexual intercourse. Are you ready to deal with an unintended pregnancy or sexually transmitted diseases? There are also emotional risks with sex. If you have sex before you're ready, if you have sex with someone who you don't trust or respect, or if you have sex that doesn't feel good, you may have stressful feelings that produce a serious emotional burden for you and your partner. Do you feel comfortable talking about your feelings with your partner? Do you listen to your partner? Can each of you share concerns? it is wise to think about your feelings for your partner, the future of that relationship, and consider the risk of disease and pregnancy.
What are some other danger signs for sex?
Do not have sex if you or your partner are drunk or high. Your partner doesn't want to use condoms to prevent STDs. You are feeling pressured to have sex. Sex that occurs under threat or sex that is forced is called rape, and it is illegal. Please seek the help of authorities or health professionals for rape or other forms of sexual violence. Sex is an act that should only be done with permission from the other partner, and that partner's opinion should be respected. For example, yes means yes and no means no. This is called giving consent. Being in agreement about sex will produce a better sexual experience for both of you. You can see that there are many important matters to consider when thinking about sex. Many young people wait to have sex for a variety of reasons.
I am waiting to have sex until I am married.
I am waiting to have sex because I am not ready to take care of a baby.
I am waiting to have sex because I am worried about sexually transmitted disease.
I'm waiting to have sex until I finish my study.
I'm waiting to have sex until I find the right person.
I'm just not ready to have sex yet.
I'm just not ready to have sex yet.
Here are some questions that people should ask themselves prior to having sex.
Do I have a good emotional relationship with my partner?
Do I know how to protect myself from STDs?
Have we both been tested for STDs?
Do I have condoms?
Do we know how to prevent a pregnancy?
The support of friends and family can be helpful. Healthy relationships make you feel good about yourself. Unhealthy relationships do not. A good relationship includes trust, honesty, equality, respect, and good communication. We hope you now have a better understanding about reproductive health and relationships.